Hello everyone, I'm Jeff Walker. Welcome to today's webinar entitled Neurokinetic Therapy, What You Need to Know. Joining me today is the founder of Neurokinetic Therapy, or NKT, David Weinstock. David is the author of the book Neurokinetic Therapy, an innovative approach to manual muscle testing. In this book he describes NKT and teaches us how we can help relieve pain and also correct dysfunctional movement patterns. NKT has been described as a very sophisticated assessment and treatment modality. This is because it addresses the causes of dysfunctional movement problems at their root in the motor control center in the cerebellum. You can see more of David's work after the webinar, so hang on because we're going to give some great information out today. www.neurokinetictherapy.com. On there you'll see details about the upcoming NKT workshops in Sydney and Melbourne. For now though, we have the great pleasure to speak with the founder of NKT in person and find out as much as possible about the technique and about whether this technique is something that we can apply to our everyday practices. Now it's my pleasure to introduce David Weinstock. David, just to get underway, the first thing I'd like to ask you is, where did the name Neurokinetic Therapy come from?
Neurokinetic therapy is a combination of, means brain movement therapy. This therapy was born out of my frustration with getting impermanent results with my regular body work and orthopedic assessment, and somebody told me that I should look into how the brain affects the body, and that was 30 years ago. And there wasn't a whole lot out there about neuroscience. I started reading about neuroscience, one particular book called The Neural Basis of Motor Control, and that particular book inspired the name Neurokinetic Therapy because I was combining neuroscience with kinesiology, manual muscle testing. It was a natural marriage to call it Neurokinetic Therapy.
Okay, and was it something you developed over a long time, or one day did you have an epiphany and you realized what you were doing?
Well, there was an epiphany, and then of course there has been the last 30 years. It's not changed dramatically, but it certainly has changed somewhat over the years. The more I learn about neuroscience, I'm exposed to other people's hits on movement and neurodevelopmental techniques. That has all impacted neurokinetic therapy and changed it for the better.
My next question was, how long has NKT been around and how long have you been teaching it?
NKT has been around for about 30 years. It originally was called neuromuscular reprogramming. I changed that to neurokinetic therapy. I only taught in California until a couple of years ago when Dr. Perry Nicholson of Stop Chasing Pain convinced me to come to New York. And since then, NKT's exploded and it's gone all over the world.
Yes, it certainly has. As I was mentioning to you before we started, I've seen NKT popping up every so often for probably since about 2010 or so, and it's just I keep seeing it more and more and more to the point where I thought I have to know more about this.
Very exciting and gratifying to watch it grow and how many people it's helping. It makes my heart full and very glad that I'm able to share my thoughts and work with people around the globe.
Does NKT overlap with an understanding of the fascial network or the fascial system?
Yes, it does. That's an integral part of it. Well, before I knew about Tom Myers, we called it fiber orientation. We noticed that muscle fibers or fascia that align themselves in the same plane work together to create movement. So the erector muscles, all the way up from the neck to the lower back, one could have effect on the other. Horizontally oriented muscles, such as the diaphragm and the pelvic floor, could have an effect on each other. And then, of course, diagonally oriented muscles, like the QL and the rhomboids, could have effect on each other. So that's how we first got around to what is now called fascial trains or fascial meridians. But there's been a lot of nice work by Tom Myers and others to do this, and we certainly use that as part of our analysis.
NKT, how does it sit alongside some other therapies? And Aaron's asked specifically about muscle activation technique, trigenics, and touch for health.
MAT and trigenics have the same roots, and NKT has some similarities and some differences. We all use muscle testing to find weak or inhibited muscles. The biggest difference with NKT, though, is that instead of when MAT and trigenics find a When they find an inhibited or weak muscle, they strengthen it by working on the distal and proximal ends of the muscle to stimulate the Golgi tendon reflex, but they're not looking for what's facilitated and causing the muscle to become inhibited. And that's what NKT does. It searches out the compensation patterns. It searches for what is facilitated and inhibiting that weak muscle. And then with the protocol of release and activate, that's what helps to reset the motor control, and you get much more permanent results. People ask me this question all the time, what the difference between NKT and those other two is. And that is the essence of it, is the reset of the motor control.
And the muscle testing is along the lines of the Kendall and Kendall muscle testing?
That's correct. I learned it from, I studied Kendall and Kendall, and then I created my own, and others have created tests that we use regularly that are actually quite unique and quite a bit different from Kendall and Kendall.
And the other thing I wanted to speak to you about was just a bit of a background. I know I've been watching Dr. Kathy Dooley's posts and her interactions with people for quite some time now, and she's quite a character, and I just want to know what we can expect from her, because I'm really looking forward to meeting her.
Well, you can expect full-on amazing energy. She's a true dynamo. She teaches anatomy at 5 different schools in New York City, including in 2 or 3 medical schools. Her knowledge is vast. She's a kettlebell enthusiast as well. And she's a wonderful representative of NKT. She's my international ambassador at this point. And everybody who takes her classes just falls in love with her and NKT and her enthusiasm for the work.
Now, that comes through strongly just in what she writes on Facebook. A dynamo is a perfect word, I think.
Dynamo she is. Dynamissimo. She's something else.
David, now from my rudimentary understanding, you use 3 levels of testing or 3 levels of pressure?
That's right. The big difference between NKT and standard manual muscle testing is that they only use very hard pressure and grade a test on a 0 to 5 scale. 5 being totally turned on and 0 being completely disconnected, probably a spinal cord injury. However, when you press that hard on somebody's muscle on a test, you have to see if they can really do it or not without cheating, meaning are they holding their breath? Are they clenching their jaw? So that kind of testing doesn't reveal very much about the neurology. It just shows you how they can cheat and compensate. So what we do, the first level of testing, we call it activating a neural pathway. We want to see if a neural pathway to that muscle is available from the brain. So the lighter you test, you can see if somebody hesitates or they could completely fail the test. They might, if somebody very strong, you have to test them very lightly to see if they shake, hesitate, if their eyes roll up in their head. All those are indications that neural pathway is not totally connected and is being blocked or inhibited by some other structure in the body.
Okay, that's similar to what I expected, so that's awesome that there is that distinction there. And do you use a postural analysis as well in NKT?
The first thing we do, we have a flow chart. The first thing in the flow chart is history and your normal history, and especially asking about scar tissue, because scar tissue, for you fascial people out there, scar tissue really interferes with the neural network. We consider the fascia and the skin to be the skeleton system of the nervous system. So when there's a disturbance in the fascial system via scar tissue, it interferes with afferent and efferent messages from the brain to the body. So that's one of the first things we ask about. Any kind of accidents, injuries. People, from working on people forget half the stuff or most of the stuff that ever happened to them, and while you're working on them, they go, oh yeah, you mean like the time I was body surfing and I landed on top of my head? Yeah, I need to know that kind of stuff. So that's the first thing we look at. Then postural analysis comes in the movement screen. You can use postural analysis. You can use SFMA, the Selective Functional Movement Assessment from Greg Cook. A lot of my students and myself, we use that. And any other kind of assessment that you already know is perfectly acceptable. And then once you've done that, then you can start to use the NKT protocol. So that's how we get started.
Do you use NKT differently for chronic versus acute injuries? Does that change how you work?
No, it doesn't change it. If something's really acute, the protocol is the same, Jeff, but in acute cases, there's a whole lot of pain I prefer to work a little bit at a time. So I'll repeat the protocol over and over again and just do a little bit of release, strengthening, go back, repeat the protocol. And I find this to be a lot less exacerbating to the pain, the acute pain, than if I just go in there and slam on it, try and work it out all at once. So I'm a big believer in serial treatment of acute conditions.
Okay. Is NKT exclusively seeking to affect the neuromuscular system, or is it rather it's trying to affect the myofascial system?
I don't see how you can separate one from the other. It's all one thing.
Mm-hmm.
I call it the neuromyofascial, musculoskeletal, whatever the hell you want to call it, system. It's all one thing. We affect the work that we do. It works with the whole thing. So that's the Western mind trying to separate things into little tiny pieces. The body just doesn't understand that. The brain doesn't even think that way. The brain thinks movement in patterns. Everything's in patterns, not in, is that a muscle, is that a fascia? The motor control really doesn't care about that. All it cares about is, am I moving with pain, without pain? Am I moving efficiently? Am I stable? Those are the kind of things that your motor control is concerned about, not what you're affecting particularly.
Is it painful at all, the NKT as a therapy?
No. Compared to many other manual therapy techniques, it's actually quite painless. You don't have to do very deep release to make it effective. Scar tissue once in a while can get a little uncomfortable. We have some people use Graston and whatnot on scar tissue, so that can get a little bit uncomfortable, but basically we're trying to minimize pain and increase neural output to muscles that are inhibited. So really, no, not particularly painful.
Okay, and for people who are wanting to come along to the workshop, what do they need to do beforehand?
Well, you have to know your anatomy and kinesiology very, very well, or you'll be really lost. So really knowing functional actions of groups of muscles, like knowing what your hip abductors are and your hip flexors and your neck flexors. Those are the kind of things you want to know. And also, how are they related to each other? By studying anatomy trains is a wonderful way to learn about how all those systems are related. So the more you can think in systems and apply anatomy and kinesiology, the better prepared you'll be. For being so patient today, I'd like to offer anyone who's interested in coming to the workshop the early bird registration price, which is $750. Right now on the website it says $850. So if you register and let me know that you heard this webinar, I'll be very happy to refund you the $100.
That sounds like a bargain, because I can imagine as these courses get more popular, there's going to be a much greater demand on them as well. Are you finding that the NKT is being taken up more by any particular therapy? So like soft tissue therapists or chiropractors, osteos, general practitioners?
It's being taken up pretty much by anybody who does manual therapy or movement therapy. So in the workshops we have medical doctors, mostly physiatrists, doctors of physical medicine. We have osteopaths, chiropractors, physical therapy, you call them physiotherapists, personal trainers, body workers. That's what the classes are really fun, because you get so many people from different backgrounds and everybody sharing what they do. It really makes for a very stimulating learning environment.
Would you describe it more as an assessment tool or a treatment technique?
It's both. A lot of people use it purely as an assessment technique, especially if you're a personal trainer and you're not allowed to do a lot of hands-on therapy. Most of my personal trainers, or you call them exercise physiologists, or you have different names in Australia, they use the assessment and then they use foam rollers or balls or whatever devices to create the releases. And that way they don't even really have to do any kind of manual therapy. So it can go that way, or it can go to the person who is a manual therapist. Then you can apply whatever release technique you already know. So I have a lot of ART practitioners who do the courses, anatomy trains practitioners, myofascial release practitioners. We get all kinds of people. I'm not trying to tell you to drop everything you know and just do NKT. NKT is more like an envelope around what you already know, and you just apply the protocol, use whatever release technique you know, and you're good to go.
Okay. All right. So with that, thank you very much. And this is Jeff Walker signing off. Thanks, David, for coming on. With that, I'll